So we do our assessment of the bony structures. So you have the pelvis, the hips. This one? What is this?
Time.
I know.
Femur.
Give me the medical term.
Femur.
Oh, the femur.
Patella.
The patella. This, you can see,
Tibia.
very, very prominent. The bony, the very prominent structure here is the tibial tuberosity. Okay. Here, you can actually feel the fibula on this side, but only on this part here. You will not feel it all the way because it's muscular. So you have the fibula, medial malleolus, lateral malleolus, the whole thing. Tarsals, metatarsals, phalanges. Okay, so any pain? No. Okay, so these are the different bony structures. Again, identify, point them out, and then palpate. If you want to do just one side, then that's fine. But the movements will always have to be both sides of the body. Okay, now let's move on to the hips, movement of the hips. So, can you please bend your right knee and bring it towards your chest? Okay, so this is hip flexion with knee bent. Assess muscle strength. This is. Okay, now let's do the left knee. Assess muscle strength. Thank you. And that is 120 degrees. Okay, next. Keeping your knee straight this time, can you please raise your right leg? All the way up. This is hip flexion with legs straight. Assess muscle strength. Okay, now the left leg, please. Keeping the knee straight. Assess muscle strength. Okay, and that is 90 degrees. That is why it is important when you have your patient do this that they're wearing shorts. Otherwise, if their pants is a little tight, it might rip. No kidding. Or you will have the very limited movement because they cannot. It's tight here in the thigh area. Okay. Next, we have internal rotation. In internal rotation, okay, we ask our patient, can you bend your right knee? Okay, lift the foot off the bed and point the right knee towards the opposite side. Internal rotation. And internal rotation is 40 degrees. We do not assess muscle strength.
40 degrees.
Mm-hmm.
How many degrees was the hip flexion with legs straight?
90. Okay, good. So we please do the left, bend the knee, lift the foot, point the knee towards the opposite side.
How many ankles?
This is 40. Okay. Next, we do the external rotation. So this time, bend the knee again. Okay, foot off the bed. This time, point the knee towards the left side. Towards the outer side. This is external rotation. And external rotation is 45 degrees. So bend the knee, left knee, lift the foot off the bed, and point the knee towards that towards the outer side. Okay, external rotation, 45 degrees. We do not assess muscle strength. Okay, next, we do AB duction. So, can you please keep your knee straight, swing your right leg outside, outwards. Okay, AB duction, assess muscle strength. Oh my gosh, it's really strong. Okay, now let's do the left, then kick it all the way there to the glutes. Okay, assess muscle strength. And abduction is 45 degrees. Okay, this time, keeping the knee straight, swing your right leg towards the opposite. Adduction, assess muscle strength. Now let's do the left. Muscle strength. Okay, and adduction is 30 degrees. Okay, so before I go into the hip extension, because you will need to lie prone, let's review. So, we start with hip flexion with knee bend. Can you please bend your right knee? Bring it towards your chest. Assess muscle strength. Okay, now let's do the left. And the angle here is 120. Okay, now this time, keeping your knees straight, raise your right leg. Up, keeping your knees. That's it. It's supposed to be 90%. Okay. Assess muscle strength. Okay. It's not a ballerina song. Okay. So that is supposed to be 90 degrees, so he may have some limitation of movement. Okay. Now we do.
Need to stretch more.
Maybe he needs to be in shorts. Okay. So this time, we ask our patient, can you bend your right knee? Okay, lift the foot off the bed and point the knee towards the left side. Internal rotation. And this is 40 degrees. 40 degrees. Now let's do the left, please. Okay. All right. All right, back to the middle. Thank you. And then we have external rotation. This time, bend your right knee. Lift the foot off the bed and point the knee towards the right. Okay, external rotation, and this is 45 degrees. Now let's do the left. Bend, point it towards the left side. Okay, so this is external rotation. Now keeping the knee straight, swing your right leg outwards. AB, duction. Now the left, please. AB, duction, and this is 45 degrees. Now again, keeping the knees straight, swing the right leg towards the left. Okay, now the left towards the right. Assess muscle strength. Add duction, and this is 30 degrees. Okay, any questions so far? And then we ask the patient, can you please lie down here? Tommy. Here. Okay, now keeping your knee straight. Okay, can you please lift your right leg? Okay, so this is hip extension. Okay, now assess muscle strength. Let's do the left now, please. Assess muscle strength, and hip extension is 15 degrees. Okay, so these are all the movements of the hips. Okay, now do you mind sitting up now? You will need to come to this side, but you will not see us from there. Okay, so the last part will be for the feet and the toes. So we start with, what's the first one?
Dorsiflexion.
Dorsiflexion. So can you point your toes upwards? And that is 100. There's no
100?
130. Okay. Please assess muscle strength. Resist. Okay. Now point the toes downwards. Plantar flexion. Okay. That's about 30 degrees. Okay. Now spread the toes apart. AB duction. Spread the toes, or bring the toes together. Add duction. Okay. Now for the eversion and inversion, okay, you need to hold the patient's ankles. Okay, you have to hold the patient's ankle so that the movement is not coming from the knee area. So this time, can you please try to bring the bottoms of your feet to face away from each other.
Away.
Away. So it's like this. It's like, you know, they do this. Okay, and that is away. The opposite side.
The other way.
The opposite.
Upward. Yeah.
Yes. Yes. Okay. So that is eversion. Now bring the bottoms of the feet, get them to face each other. Inversion. Okay, there's no angle and there is no muscle strength. So again, for the ankles and the toes, toes up, dorsiflexion, assess muscle strength, angle is about 130. Point the toes downwards, plantar flexion, angle
30 degrees.
30 degrees. Now spread the toes apart. Abduction, bring the toes together. Adduction. Now the bottoms of the feet, get them to face away from each other. Eversion, let them face each other. Inversion. Okay, so these are the different movements of the feet and the toes.
For the plantar, you do the muscle strength.
No,
No?
just the dorsiflexion. Okay, questions? Question? No questions? Okay, thanks. All right, so